We're here tonight at the Good Dentist in Derby Street, Newcastle, where we're going to go and have a look at what they're using for their imaging. Beautiful looking practice, designed and built by Perfect Practice, funnily enough. Here we have my favourite client, Dr. Gareth McBride, and Amy. How are you going?
Hello, how's it going?
Good. We're here having a look at what they're doing with the KaVo OP3D. I was hoping to have a look at one of your cases, Amy, just to run us through what you found on one of your cases.
Yeah, for sure. So we had a patient in. He had a few months actually where he thought he had some sinus issues, and finally he shows up at the dentist. It wasn't obvious as to which tooth or where his pain was coming from. So I ended up taking a CBCT. So thank God we have this one. Once I got in there, I saw, you can see quite a medium to shallow filling, but actually you can see a huge abscess off the ends. You've got on the mesiobuccal root and on the palatal root a huge abscess sitting just below the sinus. So those antibiotics, they were only a band-aid. We were able to actually assess, we opened it up, it was through and through crack, so then we organised for an extraction. So we really helped this guy out. If he kept going on the same path, I don't know what would have happened.
Wonderful. So you guys are using this system on a day-to-day basis?
Yeah, in fact, it actually helped me dodge a bullet today, Sean. I had a young lady in, needs her wisdom teeth out. I was about to suggest that she comes back in a couple of weeks to have them out in the chair. Took an OPG using this lovely machine, and whenever I took the OPG, I realised on the 3/8 there's a small radiolucency at the tip of the root, which spurred me to take a CBCT just to make sure the location of the roots on that tooth. Had a real close look on the CBCT. It appears that, well, it doesn't appear, the actual root is right into the lingual bone, and that is...
Saved you bacon.
Saved my bacon. Off the patient goes to one of the local surgeons. So not only are Amy and I finding this is a really good way of treating the general every day-to-day parts of our dental stuff, it also helps me plan implants, and in terms of our implant planning, really, back in the day before I had this in the practice, we were losing about 90% of our patients that were interested in implants. We were only having a 10% case acceptance, because as soon as they go out that door, it's very difficult to rejig and realign with that patient. Now we're sitting around about a 98% acceptance rate. Patients love to see it on the screen. They love the technology, and it's been a phenomenal addition to how we practice.
Wonderful. Thanks so much for giving me some of your time, guys, and I'm glad that everything's going well with this system, and it's a beautiful practice you've got here. And
do you mind if I interrupt as
well? No, never.
Amy's actually setting her up her own practice next month.
Yeah.
Amy has used this machine and other.
I've used this one and the other one that Australian Imaging sells, and definitely I will be going for the OP3D, or I think it's just been rebranded. So this is the one I would go for the ease of use. You just select the tooth, and 98% of the time the scout is exactly where you want it, and that's what I like.
So you find the software quite easy to use?
Yeah, really easy.
Because I really think that's a big part of the actual whole package is the software, because if the software is not easy to use, it's going to be...
and the support.
It's the support.
Support.
It's Steve Cross, Sean.
Yeah.
To be honest,
and Olivier.
Whenever we were looking at other options back in the day, there was no one to really truly train us and help get our license together. Steve was unbelievable. Olivier's on speed dial on both of our phones.
He's straight in there fixing any problems.
So
yeah.
It's a no-brainer.
Wonderful. Thanks so much, guys. Much appreciated.
Cheers.
Here at the Good Dentist. Thank you.